My name is Bryson. I'm the Director of Georgia Emergency Management and Homeland Security. I have here with me today John Haupert, Chief Executive Officer of Grady, and Dr. Kathleen Toomey, the Commissioner of the Georgia Department of Public Health. After discussions with the Governor's Office, Grady Hospital staff, and the Georgia Department of Public Health, the Governor issued an executive order today declaring a state of emergency in Fulton County due to the water pipe failure at Grady Hospital. When you think of emergency declarations, we tend to think of large-scale disasters. But an emergency declaration allows state resources and assets to more quickly coordinate response efforts, and it also allows Georgia to request resources from other states through the Emergency Management Assistance Compact. One such needed resource that has been identified by Grady is a mobile hospital from the state of North Carolina. The mobile hospital is designed to augment or temporarily replace a medical facility that's been affected by an emergency event. The mobile hospital requested will expand Grady's current capacity. The utilization of the mobile hospital is just one step being taken to ensure that any unforeseen emergency needs of the community can be met. To further alleviate capacity limitations, the Department of Public Health, GEMA Homeland Security, Grady, and other metro area hospitals are coordinating resources to ensure that the needs of emergency patients in the metro area are met and that there is minimal disruption to emergency services. And with that, I'll turn it over to Grady.
Good morning. Thank you for being here. Grady is incredibly grateful to the Governor for declaring an emergency. Doing so unlocks important state and federal resources that will help us move quickly to repair the damage and fully restore the medical care that Atlanta has come to expect from Grady Health System. This declaration is absolutely critical to the thousands of patients we treat each day and to the hospitals that voluntarily stretched their own capacity limits this past week in order to care for patients who were temporarily displaced from Grady. One thing this emergency has made clear to us is that Atlanta truly cannot live without Grady. We understand the important role we play in this community's health. On a typical day, Grady will treat and see 450 patients in its emergency department and over 1,000 patients through its ambulatory clinics and specialty clinics. During the past few days, the emergency forced us to redirect about half of our emergency department traffic to other hospitals. Grady is working to quickly as possible to fully restore our facilities so that we can resume our important role of providing needed healthcare services in the Atlanta community. And now I would like to turn this over to Commissioner Toomey, Commissioner of the Department of Public Health, for her comments.
Thank you so much, Mr. Haupert, Director Bryson. I'm very proud to be standing here today because I think what you're seeing is the role of public health in the event of unexpected emergency or health event, whether our role to coordinate and ensure the smooth functioning of the hospital system is true in Metro Atlanta, it's true statewide. And so it could be a hurricane, it could be an Ebola outbreak, or it could be something unexpected as what has been happening over the last several days. Department of Public Health has been fully engaged in coordinating with Grady Healthcare and the GEMA office to address this situation, and will continue to work until we have the system fully functional. There are two key points I wanted to make. One is that the Governor's declaration of emergency allows us to tap into assets from other states, as you've heard from both Director Bryson and Mr. Haupert. This reflects our regional partnerships with other states around emergency preparedness that will serve us and have served us well in many events. And this demonstrates the strong capacity that has been built around emergency preparedness. And last but not least, I wanted to comment that DPH will continue to be located at the EMS Coordination Center where as they were this morning, as diversion was lifted, and we ensure that the coordination is smooth and ongoing. And we will stay there and be engaged with that level of intensity until we are all functioning at full capacity. But the last word is that I am very proud of the way this has worked, the coordination with public health, and the important role that public health plays working in the collaboration with GMA and the medical community to ensure the health and safety of all Georgians.
Surely. So first of all, it potentially makes available funding at different governmental levels that we are still exploring. That is still to be determined. The one asset that has been identified, and the director spoke to it, is a 30-bed temporary hospital that is owned by the state of North Carolina. This is a hard-sided structure, very much inside, looks like a hospital and will function like one. And so that will allow us to access that asset from the state of North Carolina. And we are still determining the timeline, but quickly to get that asset in place so that we can utilize those 30 beds to provide care to our patients and to help serve as a pop-off valve for those patient beds that are under repair from being damaged by that flood. That mobile hospital will be trucked here, yes. Well, the need for the mobile hospital is necessitated because the flood that occurred took out of service 222 inpatient beds, 222 of our 700 beds that are available for treatment of patients. That's a significant impact in our inpatient capability. Grady operates every day at full capacity or beyond, and so that's a big hit. And so we are looking for assets of that nature, and also working with other local healthcare systems to determine if they have currently unstaffed available nursing units within their facilities that we can utilize to care for patients as well. Sure. So what occurred this past Saturday was that a 24-inch water line, I think that's more of a pipe than a line, but a 24-inch water line was separated at an expansion joint. And that 24-inch water line provides clean water to the air conditioning system, HVAC system at Grady. It's a pressurized line, and so it quickly dispersed a lot of water from the 6th floor, actually the 6th and a half floor in a mechanical space, quickly dispersed a significant amount of water out, and as water is prone to do, it will take the course of least resistance, and it went down and began to drain water into the 6th, 5th, and 4th floors of what we call A and B nursing buildings or patient wings. That's the new. This is the 1990s, which is newer, 1990s section of the hospital. We know what happened, but we are now determining how and why it happened. We have engineering firms locally in Atlanta that we always partner with that have been engaged and actually facilitated the very quick repair of that line. But we have also are bringing in a forensic engineer so that we understand exactly what happened so that we can determine what we need to do to make sure it doesn't happen again.
I imagine you checked the last date of the inspection of those units, which must be periodic routine inspection. When was the last inspection?
Of that pipe system?
Yeah.
I don't have that information with me, but we can get that for you.